Good afternoon, Representative and Dr. Zerwas. My name is Christina Kalam, and I am currently a nursing student at the University of Texas at Arlington. If you have a few minutes, I would like to talk with you about a topic of concern for nurses, which is nurse staffing standards and how it relates to patient safety and quality.
Of course, Christina. I have a few minutes to address your concerns.
Well, thank you. As you know, nurses perform several functions in their roles, including providing quality care to patients. With the demands and expectations put on nurses today, it is important to maintain adequate staffing levels as to avoid job dissatisfaction and increases in turnover rates. But most importantly, providing appropriate staffing levels is of major concern as it is directly correlated to patient safety, appropriate quality of care, and positive patient outcomes. Are you aware that nurses make up the largest healthcare profession, with most of them practicing in a hospital setting?
Yes, I'm aware of that fact, Christina.
Well, because nurses make up the largest healthcare profession, it is not uncommon to look at us as a way to cut costs by reducing our labor hours. The bigger picture here would indicate that cutting nursing hours could risk the quality of care provided to our patients, as well as increasing the number of negative patient outcomes. Neither of these are worth the risk of inappropriate nurse staffing levels, as they are essential to healthcare and patient safety. There's a policy in legislature. It is H.R. 1602, the Nurse Staffing Standards for Patient Safety and Quality Care Act of 2015. Are you familiar with this policy?
I've heard of the policy, but I'm not too familiar with the details. Can you share some of them with me?
Well, yes, I can. Congress found that registered nurses are inadequately and poorly monitored, resulting in jeopardized care as a result of not enough registered nurses providing direct patient care. The plan must comply with and specify a minimum nurse to patient ratio. This will help address the shortage in registered nurses in the United States and improve quality health care and patient safety. It allows nurses to refuse to participate or object to any assignment violating minimum ratios. It also states that nurses may refuse an assignment if the nurse feels he or she lacks the proper preparation or lacks the appropriate experience needed to do their assignment, which would compromise patient safety. The nurse can also refuse an assignment if it puts their license at risk. There is evidence-based data by the American Nurses Association that demonstrates key findings on safe nurse staffing, and the research studies determined that quality of care and patient safety are impacted by safe staffing. The outcome was that patient mortality increased, there were increased admissions, high patient turnovers, and discharges and transfers were related to risk of patient deaths when nurse staffing levels fell below target levels.
Well, this definitely sounds like a major topic of concern. What can I do to help?
Well, thank you for asking. What I would like to see is more support for this policy the next time it appears on the agenda. This topic is too important for the safety of the nurses and patients of the state for this policy to fall through the cracks or for it to continually be pushed back on the agenda.
Well, I certainly would keep a lookout for this policy, and I'll do whatever I can to support it.
Well, thank you very much for your time and support in this matter, and I'm looking forward to seeing it passed.